Hello, welcome to this screencast, which is for your summative task 2 for your core principles of paediatrics in primary care and the acute sector module. So what does this assessment consist of? Well, it's a 2,000 word assignment, and essentially it's building on your electronic case study presentation that you've previously undertaken. And we want you to explore the care and management of your chosen child or young person and their family in more depth. So you're going to link it to module learning outcomes 2, 3 and 4. As you will remember from your electronic case study presentation, this was linked to learning outcome 1. So if you look at the marking criteria and feedback sheet that's on the assessment tab on Grade Centre, you'll see which learning outcomes this particular assignment is linked to, and if you use those to support you in framing and writing your work, you'll be completely on the right track. So because this is building on your previous work, it's linking what you've done to the wider literature and what you did and what you can find in the literature to support your findings and your decision making. So how do we want you to present your work? Well, as with any other piece of written work, we want you to start with an introduction. So for me, this is very much about introducing your assignment. I think people often tend to get caught up in what we've asked of you in the assignment brief and just regurgitate this, which sometimes doesn't actually frame and set the scene for us as your readers and markers as to what actually you are producing in your introduction. So revisit your introduction after you've completed your assignment is a tip that I'd give to you, and then go back and make sure what you've told us in the introduction that you're going to tell us, you have actually done in the body of your assignment. So tell us what you're going to tell us. Forget that we've already seen your electronic case presentation. Reintroduce your service user, again providing them with a pseudonym and making reference to the literature as to why you've done this. So something about confidentiality and maintaining confidentiality. And within this, setting the scene in your introduction, introduce your case study service user, a little bit of background, obviously just selling it to us so it sets the scene and we can see what direction you're going in. So moving on to how we want you to present the main body of your assignment. You'll know from the assignment brief and the marking criteria sheet that we want you to critically discuss the care and management of the child and family identified from your case study. So it's about applying theoretical perspectives and concepts that underpin the care requirements of the child, including the relevant physiology and pathology and pathophysiology, and trying to include up-to-date evidence and research and use the contemporary literature base from your chosen areas. So something about what consultation model or communication theory did you use, and what does the literature say about that to support why you chose it and how it worked for you. Was it the best way of delivering this for your service user? Again, those models are given to you as potential choices in the PowerPoint slides from your electronic case study presentation, but tell us what you used and how you implemented that throughout your consultation. Present to us your systematic assessment and management. So very much thinking about the holistic care of your child, young person and their family. So their underlying pathophysiology, if they had any. What perhaps were your thoughts about differential diagnoses, and what was your management and evaluation? And again, linking how you undertook your consultation from these standpoints and linking it to the contemporary literature to support how you delivered that consultation. So what does the contemporary literature say about the chosen condition as well? So perhaps if you're looking at bronchiolitis, there's some nice guidance available to us about how we should manage that: prescribe, not prescribe, admit, not admit. Journal articles, textbooks, the research literature, all of these can to help support your decisions. So again, it's about justifying and evaluating your clinical reasoning skills through critical evaluation of the care and the management of the child and the wider family. I keep coming back to this because there's something for paediatrics and working in the role of paediatrics, that it's very much family-centred care as opposed to just patient-centred care. So what do you know about family-centred care and shared decision making? make reference to this in your discussions when you're talking about your consultation and how you had conversations with the family and work together to make decisions about moving forwards with that child. The impact of an unwell child on the family, this could be a child or young person you've chosen who's got a long-term condition, so there's something in your consultation perhaps about checking in with the parents and the carers as well, making sure that they're okay, coping, managing. And did any of these things that you find in the literature influence your consultation? Think about safety netting and red flags, and consider your clinical decision-making skills. And then finally, really that pulls through all of this is, does your professional code inform your practice and how you undertook looking after your chosen service user? So NMC, HCPC, GPHC, etc. There are others. And then finally, a conclusion. This is bringing everything together and summarising what you've said in your assignment. As a tip, this is called pulling the thread, so keeping those themes running through your work and coming to the conclusion at the end. And also from the body of your assignment, what you've read, what you find, you may learn new things as you work through this piece of summative assessment. So make some informed judgments and recommendations for your future practice. So they might include implications for your profession. They might be specific to you as a practitioner, something about for future education and research. And these may arise from your analysis, as I say, if you've been writing through your assignment. And finally, some things that you need to remember when presenting and before you submit your written assignment. You need to attach the confidentiality statement to the front of your assignment. You can use the SHU template for doing this, and that's provided on the assessment tab. So together with your name, student number, module title, number, marker, etc. Just copy and paste that confidentiality statement, and you can type your name into that. You don't have to sign it, scan it and upload it. That's completely acceptable, but it's just to make sure that you've thought and demonstrate to us about confidentiality and not naming either where you work or your service user. And again, if applicable to you, any learning contract needs to be attached to the front sheet of your assignment as well. Remember that citations and referencing needs to be presented in APA 6th edition. There are lots of resources on the module site to support you with doing this, and we would recommend that you contact Hallam Help for additional support in doing this if necessary. Again, don't identify your place of work or your service user. Remember to allocate a pseudonym. Give them a name. When we're reading these assignments and you're talking about how you've prepared and undertaken your consultation and you name that child, it really adds to our understanding, and we can feel you in that consultation and how you've been professional and caring, etc., as opposed to just patient X, patient Z, which clearly doesn't sound quite as lovely. Don't exceed the 2,000 word count by more than 10%, because then you will be penalised and you will lose 10% of your overall score. And finally, don't plagiarise. Turnitin is the tool on the Blackboard site where you can keep turning in your work to have a look at it and see if you're able to paraphrase others' work into your own words. So if you're uncertain and you've not written at an academic level 7 for a little while, then use that to support you to make sure that you are paraphrasing others' work. I hope that's been useful to you. Of course, you can use us as your academic advisors and markers at any time to contact for support with your assignments. We can read 500 words going along sort of 10 days ahead of submission dates. So get in touch with us if you need, but hopefully this is a good starting point to support you in your writing. Looking forward to reading your work, and thank you very much for listening.